Let us go to Canberra now to catch up with Victorian Nationals MP Dr Anne Webster. Good to talk to you again, Anne. I bet you're pleased you're in Canberra and not at home.
Well, I feel both guilty and pleased to be here. I have had so many emails and phone calls from very distressed people back home. And of course, if I went home to do the work that I need to do at home, it was a risk that I might not be able to come back. So it is what it is.
Look, I think it's a very pleasing development today to see the Prime Minister demanding these restrictions are lifted as soon as possible. I can understand he's tried to stick to his knitting, not to tell the states or dictate to them how to run their state. But he's very much running out of patience, it seems, with the Victorian government.
Well, I'm very pleased to hear what the Prime Minister had to say. I'm certainly running out of patience. For regional Victoria, as you know, my electorate is over a third of Victoria, northwest and west, and we've had no COVID for many, many months in some areas such as Mildura, 14 months since we've had a case there, and yet we were locked down last week and the restrictions have remained in place in part, severely hampering businesses, whether they're gyms or hospitality and other small businesses, and there's actually been no support for them.
Look, it is bizarre. We crossed up to the state MP for Mildura last week. To think of that city so far away from Melbourne, no cases, as you say. How could it be that a state government would lock people down in such an obviously unnecessary way? Is it because they just don't understand the regional parts of the state? They have no idea what they're doing? Or is it just to make the rules easy, to make them uniform across the state?
Well, I think you hit the nail on the head. I think it's about bureaucratic simplicity. The simpler you have the policy, the easier it is for those in Melbourne. However, it is extremely unfair. And there are individuals who can't see, for example, I've got a woman in Horsham whose husband, Ross, had a severe accident in Queensland last week, is in ICU, and she is not allowed to go visit him. We have people who run businesses who are losing $25,000 a week, have 30 staff who are not employed and are not able to receive any payments at all. There is just a gross misjudgement, I think, on the part of the state government, and regional Victoria needs to have its restrictions lifted entirely.
It's just terrible, and we're going to talk to people later in the program again who are living through this. The pain, the trauma of casual workers suddenly with no income, of small business people seeing everything dry up around them and their bills still keep coming. And of course, they have enormous concern and empathy for their workers as well. But when I watch, you know, the ministers and the acting premier and the bureaucrats in those daily press conferences, they don't seem to get it. They mouth some platitudes saying, oh, we know it's kind of tough for people, but you don't get a sense that they really do understand the impact of all of this.
No, I don't get a sense that there's any empathy at all. I think it really comes down to we're managing this crisis one more time. It honestly feels like rinse and repeat from last year, and this is our fourth lockdown. You know, there needs to be a confidence in the contact tracing systems. There needs to be a confidence in the isolation mechanisms that are being put in place. As we've heard, New South Wales has managed to have a proportionate response. It's a measured response. That is what we need in Victoria. They just cannot keep doing this to regional Victoria and to the wider population outside of Melbourne.
Well, what about your own government then? You've said you're pleased to see the Prime Minister talking about let's get these restrictions up as quickly as possible. Of course, he's helped out with the extra payments to help those casual workers and small business people to split the costs of that last week. Obviously, Canberra has some sway in this because of the money. Should he be demanding that the states don't lock down any further, except in the most extreme circumstances, to lay out some targets or some criteria perhaps, because we know that most of the vulnerable are vaccinated already. We know we've got enormous healthcare capacity. We know that other people who want it are lining up to get the vaccine. Surely it is time to kick these lockdowns to the side.
Well, I mean, we do have criteria. The criteria is a Commonwealth determined hotspot. But that has not been accepted by the state governments. They've done their own thing and have not got the rolling 3-day, 3 cases for regional Victoria. We've got nothing, and yet we have serious restrictions. Even in Melbourne, they haven't reached a 3-day rolling standard or level that warrants the Commonwealth definition of the hotspot. This is hugely problematic. I mean, we need to have criteria that is set and responses that respond to that criteria being met, and not constantly changing the rules and changing the boundaries for the decisions that are being made. Australians want to get back to Australia as one country, not these lockdowns where we are effectively many, many states.
Spot on. We've got to have national standards, and we can't just accept you have good state governments and bad state governments. If you live in New South Wales, you're lucky. They'll keep the state open and tackle the outbreak. If you're in Victoria, you're crushed.
Yeah, absolutely. I couldn't agree more. And Victorians are down. I think they're disheartened. Those who are in full lockdown, I honestly think that the issues that we are facing with mental health, the economic issues are so serious that we'll be feeling it for some time to come. Victoria has to do better than this.
Yeah, thanks for joining us, Anne. I appreciate it.
You're welcome. Thank you.
Dr Anne Webster there. She's the Nationals member for the seat of Mallee there, as you heard, in the north and west of Victoria.